flexion to start. So can you point to your chin so I can see under your mask? I'm just going to stabilize. Now I want you to nod down. All right, perfect. And we're just looking for range of motion. This next one, I want you to poke out your head just like that, and then I want you to look up as much as you can. Perfect, and you can relax. So here we're going to be doing the cervical flexion rotation test. So what we're going to be doing is bring her up into flexion, and this is all passive. So we're bringing her up into flexion, and we're looking for asymmetries for less than 45 degrees. And if she had either of those, that would indicate that there's an issue present. All right, so here we're going to be doing various measurements of for TMJ. So to start, I'm going to do mouth opening. So I'm just going to have her open her mouth. Can you do it slower so I can kind of observe how your mouth moves? So here we see a C pattern. It has a slight deviation to the left, about 10 meters of mouth opening. All right, it's fine. And she is at 50 millimeters, which is normal. So next, can you do this so I can see her teeth? And this one I'm measuring excursion, so I'm going from the center of her top two front teeth to the center of her bottom two. And while she's just sitting here, it's deviated slightly, so can you go ahead and move the bottom of your jaw to the right? So as mentioned before, you can see a slight deviation to the right for about 3 millimeters, and that's at a resting position. All right, and she's at about 19 millimeters, which we would expect it to be about 1/4 of the distance for her mouth opening. We're doing cervical isometric muscle testing. So to start, I want you to bend your head forward just slightly, and then I'm just going to apply some pressure and just don't let me move you. Okay, good. And then I'm going to do the same in the back. Don't let me move you. All right, and then can you bring this ear to the shoulder? A little bit less. And then I'm just going to push, just don't let me move you. Okay, relax. And then next I'm just going to rotate and then just don't let me move you. Myotone testing. So the first one I want you to do is I want you to flex forward, and I'm just going to hold it for 5 seconds. All right. And then the next one is rotation. So can you rotate a little bit for me first? So we want it in a shortened position for all of these. And I'm just going to rotate and hold it for 5 seconds. Next one, can you side bend this here to the shoulder? And then same thing, I'm just going to push. All right. And then can you shrug your shoulders up? All right, I'm just going to push down for 5 seconds. And then can you bring your right shoulder up like this? I'm just going to push down 5 seconds. Can you bring your arm up like this? Push down. Right. Up like this. And I'm just going to push down. Alright, and then come down like this. And what I want you to do is I want you to bring this thumb up. I'm just going to push down. Next, I want you to bring your fingers out like this. I'm going to put my fingers in between. I just want you to squeeze. Squeeze. Alright, so here we're going to be doing the craniocervical flexion test. So basically what we're doing is using a blood pressure cuff. Typically we would have a device to use this so she would be able to see the pressure that she's at, and she could hold it in front of her and see. But for now, we're using the blood pressure cuff, and she's not able to see it because the cord isn't long enough. So essentially what we did was we pumped it up to 20, and she is going to do a chin tuck and try to get the pressure up to 22. So go ahead and do a chin tuck, a little bit less, a little bit more, right there. And I just explained where she was at verbally because she's unable to see the actual number that she's at. And then we would hold it for 10 seconds, and we'd continue to progress up by 2 each time. And we're gonna, if she gets to 26 and holds it for 10 seconds, then she's considered normal. So here we're gonna be doing the deep neck flexor endurance test. So essentially what I want you to do is to kind of gain an understanding of what we're doing is I want you to put your finger on your chin. I want you to slide your chin back kind of like your whole head's going down like an elevator. Perfect. I want you to hold that for 10 seconds. Again, release your fingers. All right. And during that, we want to look for larger muscles firing, such as like SCM, just to ensure that they're using the correct musculature. So now we're going to do the same thing, but I'm going to raise your head up about 1 inch. Alright, so go ahead and do that same chin tuck. Okay, good. And then I'm just going to release my hands, and we're looking for larger muscles to fire, or her to lower her head, keeping relaxed. Which her SEM was very apparently firing, so she would not be normal for this test. Alright, so here we're going to be doing the upper trap length test. So what we're going to do is we're going to flex the head, and this will be done all passively. We're going to side bend away and rotate towards. And then we're going to depress the shoulder, and we're just we're expecting a nice stretch here. And we want to check bilaterally to see if there's any asymmetries. So here we're going to be checking the levator scapula. For this one, what we're going to be doing, very similar to the trap, but we're going to be flexing the head. We're going to side bend away, and we're going to rotate away. That should put some tension, and then we're going to just depress the shoulder, and it should create a little bit more tension. We should feel a nice stretch similar to the trap. And we want to check bilaterally just to see if it's symmetrical. So here we're going to be looking at the SCM. So can I have you slide your head so it's kind of off the table, and I'll help support you. Maybe that's it. So for this one, what we're going to do is we're going to let her extend her head slightly. We're going to side bend away, and we're going to rotate towards. And for this one, you can also depress the sternum to kind of increase the stretch. So I'm just going to pop it right here. I'm just going to apply slight depression in this position, just to give it a little bit more of a stretch, and we're going to check bilaterally to ensure that they're symmetrical. Alright, so here we're going to be doing the muscle length test for the scalings. So for this one, we're going to start with middle. So what I want you to do is I want you to grab the table just like this, and then you can reach the other arm up onto the top of your head. And we're just going to go side like you're trying to touch your ear to your shoulder. And I want you to really kind of pull down onto the table, and the slight overpressure for the scaling. You can just kind of assess bilaterally for the muscle length. The next one we're going to do is the posterior. So what you're going to do is you're going to put your hand behind your back, and I want you to look towards your right armpit, and then you're going to kind of provide the overpressure just like the other one. And same, we're going to assess bilaterally and see that it's symmetrical. And then for the last one, it is posterior. So what you're going to do is you're going to side bend and look towards the side leg we're stretching. And then you can apply a slight overpressure right here with the right hand. And same again, we're just going to assess bilaterally to ensure that they're even or symmetrical. For the AA distraction, what we're going to be doing is we're going to be stabilizing C2, and then we're going to apply a distraction to C1. And we're going to apply a distraction to C1. And we're just looking for kind of a relief in symptoms that she may be having. And then general distraction, we're just going to be kind of like the distraction test, but in supine. We're going to be placing our hands here and just pulling just like we did before. And then we're going to release slow, similar to the distraction test. But we would hold it for a more prolonged period. We're going to be doing the anterior shear test. So essentially what we're doing is I'm going to find the posterior arch of C1. And I'm just going to lift her head towards the ceiling. And what I want her to do is keep her eyes open so you can open her head. And we're looking for 5Ds, nystagmus, any reproduction of her symptoms or anything like that. If we were doing the sharp cursor test, to start we're going to apply in C2. And for this test we're looking for the 5Ds, so I'm going to be looking at her eyes typically, but I'm not going to for sakes of camera purposes. We want to look for a clunk and a lump in the throat, and these would all indicate a positive test. So we're going to stabilize, and I'm going to have her go into slight flexion, and then I'm just going to apply some pressure. And what we're looking for is that just to slide over. So here we're going to be testing the alar ligament we're going to do the lateral flexion and rotation for testing the alar ligament. So basically what I'm going to be doing is I'm going to find C2. And I'm going to stabilize it. And once I stabilize it, and then I'm going to go into slide bending to start. And what we're looking for is just, we want to feel C2 moving with the with her head. And we'll go into the other side, so stabilize. I am feeling it. And then same for the rotation. So we're just going to rotate. I felt that very early on. So on this side, rotate. And also for this, we're looking for like the 5Ds and signs of vascular occlusion. So here we're going to be doing the transverse shear test. So essentially what I'm going to be doing is placing, we're going to be using like our thrusting knuckle. We're going to be putting one on C2 and one on C1. And we're just going to stabilize at C2, and we're going to do a transverse slide or translation of C1 towards C2. So we're just going to palpate. You look at it a second. I palpate it, I'm just going to stabilize, and I'm just going to apply a transverse shear. We're looking for 5Ds or a clunk or an nystagmus, so it won't hurt to keep our eyes open during the process. Alright, so here we're going to be doing the brachial plexus compression test. So what I'm going to be doing is I'm going to be kind of going in between the SCM and the trap and behind the clavicle just a little bit. And we want to, the brachial plexus runs between the anterior and middle scalene, so what we're going to do is we're going to press kind of on that, and we're looking for a reproduction in symptoms or kind of a like zing type sensation. Be like right here, and we're just going to apply some pressure and be looking for those things that I mentioned before. So here we're going to be doing the abstraction test. So for this one, we would want her to have symptoms already, and then we're going to be looking for a relief in symptoms, which mean a positive test. So essentially, what we're going to be doing is just lifting up. We're going to hold for about 30 seconds. For purposes of the video, I'm not going to, but we would just ask if the symptoms get better, and then we're going to release the distractions slowly. Alright, so here we're going to be doing the Sperling test, and then after that we're going to do the Jackson test, but we're going to start with the Sperling. So essentially what we're going to do is we're going to have her side bend, and then we're just going to apply some compression, and we're just looking for radiating symptoms down the arm. And we would typically check that bilaterally to see if there's any difference. So, and then we're going to do the same with rotation. And then we're going to apply some compression. And we're going to do the same thing, so looking for radiating symptoms or, and also checking bilaterally. Here we're going to do the shoulder abduction relief test. So what we would expect her to have is essentially radiating pain or numbness, and what we're going to do is we're going to bring this up and kind of place your hand on your head, and what we're looking for is a relief in symptoms, and that would be a positive test. Alright, and then so here we're going to be doing the upper limb tension testing. So the first one we're going to be doing is median, so we're going to abduct, we're going to depress, we're going to externally rotate, we're going to bring the wrist out just like this, then we're going to extend at the elbow nice and slow. We don't want to cause too much pain. I just want you to let me know when you start to feel it, okay? Alright. And that's the tension test, but to use it more as an intervention, we can kind of come in and out, essentially like flossing, yeah. So the next one, what we're going to do is the radial. So we're going to do the same setup, so we're going to bring it into about 10 degrees. We're going to externally rotate as much as she's able. We're going to flex the hand, and then we're going to depress the shoulder, and then we're going to extend the elbow. Nice and slow, and just let me know if you feel it like last time.
Sorry, Aaron.
So she has no problems with this upper limb. So here we're going to be doing the ulnar nerve upper limb tension test. So essentially what we're going to be doing is we're going to be pronating, extending the wrist. We're going to depress the shoulder. We're going to abduct and flex kind of at the same time. So I can use my leg to kind of give some assistance. And I'm just going to make sure that she's not feeling any pain, so just let me know when you start to feel it. there, so she's probably fine with that, but again, like I said before, if you have problems with that, you can kind of floss it. And for all of these, you can side bend the head to the side and it'll sensitize it more. The Learmite test. So what I want you to do is I want you to slouch forward and flex your head to your chest kind of. And what I'm going to do is I'm just going to lift her leg. And we're looking for kind of a zing down for her extremities, which will indicate a upper motor neuron lesion. Alright, so here we're going to be doing a Hawton's test. What you're going to do is I want you to bring your arms just like this and keep your head straight and just close your eyes for me. And for this, we're going to hold it for 10 to 30 seconds and we're just looking for a change in the movement of her arms. And for this portion, it would be considered non-vascular, or would indicate non-vascular. So next, you can open your eyes and what I want you to do is I want you to look towards me kind of and back here. And then close your eyes again. And for this one, we're essentially checking the vascular portion, and we're just looking for the difference or sway, significant sway in our arms. And again, we're going to hold for 10 to 30 seconds so you can go and open your eyes. We're going to be doing the vertebral artery quadrant test. So what we're going to be doing is we're going to be going into extension. We're going to side bend, and we're going to look away from the side that we're testing. So for this one instance, we'll be testing the left side. For this, we want to look for any signs of vertebral artery occlusion. So it'll be like the 5Ds, nystagmus, anything like that. All right, and we'll just come back and relax. First rib mobility. So essentially what we're going to be doing is we're going to be palpating for the clavicle, and we're going to come slightly off of that. We want to check both sides. What we're going to have her do is just take a deep breath in. So take a deep breath for me. What we're doing is we're just feeling for that rib to be moving around unnaturally and just kind of hyper or hypomobility. Alright, so here we're going to be doing the thoracic outlet syndrome test. To start, we're going to be doing the absence, so down over your hand. We're going to find the pulse. Alright, and then you're going to what I want you to do is I want you to look to your right. I'm going to bring your arm back just a little bit more. And I want you to take a deep breath in and hold it. Alright, you can relax. And for that, we're just looking for a diminished pulse. Doing the right test. So to start, I'm just going to find your pulse. Raise our arm up, and I'm going to have her look away, so look to your right. And for this, we're just looking for diminished pulse, or like a paresthesia. We're going to hold it for about a minute. All right. Next, we're going to be doing the costoclavicular test. So for this one, what I want you to do is I want you to, well, I'm going to take your pulse first, and then once I find your pulse, what I'm going to have you do is I'm going to have you get into a nice upright posture. Alright, I want you to poke your chest out for me, and I'm just going to depress the shoulder. And we're going to hold this one for about a minute also. And we're looking for a diminished pulse. Can you bring your arms out just like this for me? And what I want you to do is just open and close your hands. You can do it nice and slow. And we're going to do it for about 3 minutes, and we're just looking for any distinct changes in the speed that she's doing her hand closing, any neurologic or vascular symptoms. And we can look for like asymmetry with how she's opening and closing her hands, and that would indicate a positive test. Okay, anything else? Alright, so here we're going to be doing the passive shoulder girdle elevation test. So what I want you to do is cross your arm just like this. And for this one, we expect her to have symptoms, whether it be neurologic or vascular. So we can feel her pulse during this, or we can just ask how, if she's regaining feeling, like losing reduced numbness or anything like that. So what we're going to do is we're just going to passively elevate, and we're just looking for those symptoms that I mentioned earlier. And then we're just going to relax. So here we're going to be checking her reflexes. We're going to start with brachioradialis. So can you go like this for me? All right, and relax. One more time. All right. All right. Can you bring your arm up? Yeah, perfect. And relax. All right. And it wasn't very noticeable, but I felt it. So next is triceps. Bring it out like this. All right, so here we're going to be palpating her masseter start. So what we're going to do is we're going to feel right here and just tell her to clench her jaw. All right, and I can feel her masseter from here to here. Next we're going to be feeling for her temporalis. And for both of these we want to check bilaterally just to kind of get an idea and ensure that that's not the pain generating area. So go ahead and clench your teeth once again. All right, and I can feel her temporalis, and it runs down through here. Next, we're going to do the jaw jerk reflex. So can you open your mouth, like slightly? No, just like that. And she is normal for her jaw jerk reflex. So for palpating the medial pterygoid, what you want to do is you want to slide kind of on the inside of your teeth, or the medial side, and you want to go all the way to the back of your mouth and go slightly superior. And you should feel a muscle type tissue, and to confirm you can either kind of bite down on your finger or you can contralaterally deviate. And for the final palpation we're going to do the lateral pterygoid. So what you want to do is you want to go across the top portion of your teeth past the molars, and you should feel a hard bony surface on the lateral side, and then on the medial side you should still feel your teeth, and then you just keep going past that and you should feel the lateral pterygoid. And to test to see if you're on it, you can protrude your mouth and it should pop out. So here we're going to be instructing on how to maintain normal position of the mouth and tongue. So to start, can you kind of explain how you keep your mouth normally and your tongue normally? So like, are your teeth touching? Are they separated?
My teeth are separated and my tongue just rests in the middle of my mouth.
Okay. So for maintaining normal position, we want your teeth slightly separated, so not clenched, not touching, but just a little bit off of that. And we want your tongue to touch the top of your mouth like you're saying no. So like the end part of no. All right, are you like that? Mm-hmm. Okay, so for this we could work on holding it for a prolonged period and just maintaining that area, just so that you can kind of get used to that that feeling of how your mouth should normally be situated. Okay.